And Cyril, are we ready to go?
Yeah.
Okay, welcome everyone. I'm Pam Cipriano, President of the International Council of Nurses, and I'm so pleased that you have joined us today for our briefing on the state of the world's nursing workforce and some of the work that ICN is doing to improve health globally. I'd like to first start by acknowledging the tragedy that continues to unfold in Turkey and Syria as we mourn the tremendous loss of life, as well as the heroic efforts of first responders and nurses and all healthcare personnel and all of the individuals that are helping to address this tragedy and disaster. So our thoughts are with them. ICN has reached out to offer our condolences and support. We're pleased again that you've joined us today. You'll be hearing from some of the leadership at ICN as we share with you a number of updates and information. And we know that you may have some questions that arise as you listen to our presentation, the first part of this webinar. So please use the Q&A at the bottom of your screen if you would like to put a question in. And we will most likely wait and answer those at the end. If there's simple ones we can do throughout the session, I will go ahead and do that, but we'll want to be able to get to as many as possible. Next slide, please. We know that there are many nurses on the call, but many of you may not be familiar with the International Council of Nurses. And we are made up of over 130 national nurses associations from around the globe in all of the WHO regions. We are a very senior organization founded in 1899 and the first to be recognized as a non-governmental organization by the World Health Organization. And we have really valued that long-standing relationship that we are closely tied to those global agendas. We also believe one of our most important parts of our work is that we represent the voice of more than 28 million nurses around the world. And so that's really who we work for every day through our members as well. And so we are one of the largest and most far-reaching international organizations. And let's go to the next slide. What's important is that we think about our mission and vision, which is really, again, what frames our work. And we do represent nurses worldwide, and our goals are really to advance the nursing profession, promote the well-being of nurses, and also, very importantly, advocate for health in all policies, because we know it is the influence that we have in the policy arena that can make change and improve health for all. So our vision really is also the empowerment of nurses so that the world views, recognizes, supports, and invests in nurses so that we can, in fact, assume our role as leaders to be able to deliver health for all. And if you go to the next slide, I want to share with you some of the relationships and the work that we have. Next slide, please. We're, again, very pleased that we have a close relationship with the World Health Organization. And we meet routinely with the Director General, as well as the Chief Nursing Officer. As you know, we have a new Chief Nursing Officer, and we have welcomed Amelia and look forward to working with her. Had a very close relationship with Elizabeth Iro in the past. And we are very keen on making sure that we stay very closely aligned with the work of WHO, both through things like the World Health Assembly, interventions at the WHO Executive Board, which has just been completed. You may have seen our press release on those interventions. And we also work collaboratively with our Quad partners. So we work with our regulators, with our educators, with our chief nurses, and with all of our associations across nursing as well as midwifery. We'll be sharing with you just a little bit more of some of the key work that's been done over the last 2 years, specifically the strategic directions for nursing and midwifery, building on the State of the World's Nursing Report. So let's go to the next slide. And I want to share with you, again, just a snapshot of how our work aligns with the World Health Organization priorities, because we believe it's really important that in addition to the work that ICN does to improve and advance the nursing profession, that our work has an impact and that it has a reach, again, on the global health agenda. So even in addition to WHO, and the WHO priorities, as you know, really relate to having people be healthier and not have extreme expense, which is part of the universal health coverage agenda, making sure that we're able to respond to health emergencies and prevent them and respond to them, which has been made ever present with the COVID pandemic, and then also being able to expand and ensure health coverage of a set of benefits to billions of people. And you'll see the 1 billion on the slide here for each of these areas. This has been the triple billion aim of WHO. But we've had a very full agenda of activities and priorities that in many ways, again, complement that work. So we have been working for many years to advance the Sustainable Development Goals of the United Nations. And that includes being able to address universal health coverage. We're working very closely on that as the agenda continues to advance within the United Nations. We again are very invested in public health and public health emergencies. We have been advocating throughout the pandemic for better support for the public health workforce and all direct caregivers in terms of their protections and making sure that we have vaccine equity and prioritization, all of the things that we know have become very apparent during the public health crises. We've been responding to those in need through humanitarian disasters, both man-made disasters as well as other issues that we know, again, of whether it's earthquakes or tsunamis or hurricanes or things like that. So being able to respond to those who are affected by conflict or other concerns. We continue to be focused on human resources for health. And as the focus of this conversation today is workforce, this has never been more apparent as we know that we have a whole new set of circumstances as we've seen people depart from the workforce, as we've seen stressors in the work environment. But we continue to be very clear about our desire to make sure that nurses are protected, respected, valued, and make sure that we are addressing their needs so that we have a robust nursing workforce. You may have heard the comment that there's no health without a healthcare workforce. The other part of that is there's no healthcare workforce without nurses. So let's go to the next slide. And this next one details some of the work that is presented in the Global Strategic Directions for Nursing and Midwifery. There are 4 major areas of focus. I hope you're all aware of this report. This is a primary emphasis of our work together across our relationships in ICN with our partners, and it is strengthening education, creating and supporting more jobs, improving service delivery and the welfare of all of us as caregivers, and improving and expanding leadership. And in the next slide, we talk more specifically again about the impact that we can have as we strengthen nursing and midwifery. And that is our ability to help influence universal health coverage, the goal being by 2030. And there's not very many years left, but we're very pleased to be part of the task force that has just issued an action agenda to achieve universal health coverage. It will be presented in its final form at the UN high-level meeting in September later this year. So this is a busy year. It is a year of action. It is a year of moving out of beyond the pandemic. And so if you'll go to the next slide, Cyril. One of our most exciting events is the Congress that ICN holds this year in Montreal. We welcome nurses from around the world for dialogue, discussion, debate, learning, creating relationships. It's the largest global event for nurses, our theme being Nurses Together, a Force for Global Health. This is really our time to have the most significant impact and influence. So I look forward to seeing all of you there. And now to share a little bit more information about some of our programs and the work that is shaping our influence on the health workforce is our CEO, Howard Catton.
Thank you so much, President Cipriano, and let me add my welcome to you all to this briefing on the work of the International Council of Nurses and indeed the global nursing workforce. What you can see on your screen here is a graphic taken from a report that we produced with the World Health Organization back in 2020 called The State of the World's Nursing. It's the first time that we've ever had a global report with WHO detailing the current distribution numbers, distribution of nurses around the world. And indeed, it looks into a range of other issues in terms of nursing practice and nursing leadership. What I think you will find striking when you look at this image is the huge variability that exists in terms of the distribution of nurses around the world. Currently, we're probably moving close to 29 million nurses globally, but they are not spread or distributed evenly. And in fact, you can see here, there's as much as a 10-fold difference between the numbers of nurses per head of population in some countries, most commonly the lower income countries, compared to the higher income countries. And you can see that most starkly illustrated on the continent of Africa. Next slide, please. So you can see that image there of the State of the World's Nursing Report, the 6 million shortage that identified in the lack of nurses globally. But importantly, that data was before the pandemic. It was collected in 2018, 2019. And the 6 million shortage of nurses was in the context of what was believed at that time to be about an 18 million shortage of healthcare workers generally. So nursing making up about a third of the overall shortage. But if you follow the arrows to the Aging Well report, this was a report that ICN produced with our partners from CGFNS in the US, where we looked specifically at the aging of the nursing workforce. And we identified nearly 5 million, 4.7 million nurses who were intending to retire probably in the next 5 or 6 years. That 4.7 million figure, add that to the 6 million, we're up to about a figure of 10 million nurses that the world needs to replace. But then, as we know, we were hit by the pandemic, and ICN produced about this time last year a report called Sustain and Retain, where we looked at the evidence that was emerging in relation to the impact of the pandemic on the global nursing workforce. We all know nurses have been absolutely at the center of the response, but it has taken a huge toll on their physical and mental health. And as a result of that, this report did some modeling to suggest that we think that 2 to 3 million nurses, additional 2 or 3 million nurses could be looking at retiring earlier than they otherwise would have done. And we said, we think we can see this COVID effect, and this is how it translates in relation to global nursing shortages. There's been work by others, the Institute for Health Metrics, who actually put the total figure, the global shortage of nurses, up as high as 30 million, because they include a lot wider, more comprehensive set of indicators about health needs to be met and the numbers of nurses to do that. Next slide, please. This slide just gives you a little bit more of a taster of what was in that Sustain and Retain report that I mentioned. The fact that we can add up to this figure of 13 million nurses, but we also in this report unpicked another phenomena that we were seeing occurring, an increase in the recruitment, international recruitment of nurses around the world, high income countries using it as a fix to address their nursing shortages. And ICN in this report called strongly for countries to aim to be more self-sufficient in the supply of their own workforce. We set out a 10-year plan for how we think the roadmap to achieving a sustainable global nursing workforce. Watch out, colleagues, because in the coming weeks, we will be producing an updated report from Sustain and Retain with the latest evidence that we have from the last few months. Next slide, please. I have mentioned that we all know the immense toll that the pandemic has taken on our nurses, our health workforce around the world. And this slide is based on some surveying that ICN did during the pandemic, particularly about the impact on nurses' mental health. Our national nursing associations, more than 130 national nursing associations are members of ICN. 80% of them said to us that nurses were reporting psychological and mental health distress to them. And they were also reporting that this was incredibly complex, of people who are experiencing anxiety, exhaustion, burnout, but through to people who were experiencing PTSD symptoms. Tragically, we had a small number of suicides as well. And the complexity of these issues were added to by some of the victimization and abuse that we saw of nurses, the COVID deniers claiming that it was all a fake as well, adding to the burdens and the pressures on our health workforce and nursing workforce. And we described this at the time as being a mass traumatization of the global nursing workforce. And you can see from the numbers that I've shared how that has translated through into some nurses quitting and leaving earlier than they otherwise would have done. On the international recruitment issue, this slide just gives you a feel for some of the numbers involved. These again from the Sustain and the Retain report, but you can see this runs into tens, hundreds of thousands that some countries are short of nurses. And it's a phenomena that it isn't just the US and the UK, Germany and Australia. We've seen in recent months countries who've not recruited as much internationally in the past, but now stepping into this space to recruit, places like France and Finland and Canada, and a selection of the countries that they're recruiting from. And that gives you a sense of the source countries often being the lower income countries. And if you think back to the map that I showed, my first slide, a lot of these countries losing their nurses to international recruitment have lower density of nurses in the first place. We have and we continue to work very closely with WHO on the global code of practice for international recruitment, and there is more guidance coming forward in relation to international recruitment. Those of you, if any of you listened to the Director General's remarks at the beginning of the Executive Board just last week, he specifically name-checked international recruitment as an issue of concern, and that he wanted to provide more protections from those most vulnerable countries who are losing their nurses. Next slide, please. Why does all this matter? Why does all this matter? Is this just about an interest from ICN to support and to protect nurses around the world? Absolutely, and we believe that we have a very significant job to do. But the reason we do that is because it matters for the health of the planet, for the health of people around the world, and quite frankly, it saves lives. This graph that you can see here is taken from a report published by the European WHO European region, but it uses data from collected from around the world, and you can clearly see how life expectancy increases where there are more healthcare professionals, nurses, doctors, and midwives, where that density is higher, longevity increases. There is more evidence. This is just but one example. There is plentiful evidence, not just of the links to mortality, but to the quality of care, to access of care, to people's ability to maintain independence and to their state of health and well-being for longer. Next slide, please. Many of you, I suspect, will know, some not, but we celebrate every year on the 12th of May, International Nurses Day, celebrating the anniversary of the birth of Florence Nightingale. Our theme for this year, ICN set the theme for International Nurses Day each year, and our theme is Our Nurses, Our Future. And you've heard very clearly from our president, from Dr. Cipriano, that we need to very clearly established what our health systems need to do in the future to make sure that we learn the lessons from the pandemic, but we don't go back to those old ways, to the weaknesses, the fragilities that we know that we had before the pandemic, the lack of the preparedness that we all experienced. And we will be setting out a very clear nursing charter of the actions that need to be taken to support, protect, and invest in nurses and healthcare workers, but also in our health systems, for the health system strengthening that we need to see to deal with the global health challenges that we know that we face over the coming years. I'm delighted now to pass to my colleague, the ICN Chief Nurse, Dr. Michelle Acorn. Michelle, over to you.
Thank you so much, Howard. Our CEO is a nurse, Howard Catton, and our president, of course, is a nurse as well. I think it's important as a global voice of nurses, we continue to amplify that and lead on. As a chief nurse, I'm also an advanced practice nurse, specifically a nurse practitioner. And if we could go to the next slide, please, I'd like to kind of talk you through some advanced practice. Advanced practice nurses are crucial partners in achieving the Sustainable Development Goals, universal healthcare coverage, primary healthcare, person-centered care, patient safety, and for emergency preparedness and disaster responses. We know that advanced practice nurses can be achieved to leverage and influence systems and impacts as well. Advanced practice nurses are competent and capable to deliver advanced nursing and health services and build a health workforce in terms of capacity across health, social, and academic centers as well. When we think of sectors, we really need to consider where we make the most impact with advanced practice nurses, nurse-led models of care as well. The ICN guidelines on advanced practice nursing in 2020 that were published enhance clarity. And I'd like to walk you through the definition to ensure that you understand what an advanced practice nurse as a generalist or specialized nurse is able to provide for us. They have acquired knowledge through graduate education at a minimum of a master's degree. They have an expert knowledge base. They can apply their complex decision-making as well as clinical and leadership competencies. And it's shaped by the context, such as your country and where they're credentialed as well. You may have heard, of course, of clinical nurse specialists who are also advanced practice nurses who provide expert clinical advice and care based on established diagnosis in specialized clinical fields of practice, along with systems approaches. Or you may know of a nurse practitioner as well, who are advanced practice nurses and integrate clinical skills associated with nursing and medicine to assess, diagnose, manage patients in primary healthcare settings, as well as acute care populations for population health, chronic illness, health promotion, and disease prevention. Advanced practice nurses are viewed as advanced nursing interventions in terms of nursing, how we influence clinical health care outcomes and for individuals, families, and populations. You may also have heard of certified registered nurse anesthesia, as well as certified nurse midwives. Please have a look if you would need further information on the guidelines on advanced practice nursing. And we have some great resources on nurse anesthesia as well as nurse prescribing. Next slide, please. The State of the World Nursing Report highlights key directions for workforce policy, including optimizing the contributions of advanced practice nurses and direct clinical care, of course, for individuals, families, and communities. Also, actions that ensure that nurses are working to their full scope of practice to meet population health needs by improving primary health care through access, supporting nurse-led models of care, and advanced practice care roles are important. We highlighted earlier the WHO Global Strategic Directions for Nursing and Midwifery that were adopted at the World Health Assembly and the 4 policy priorities of education, jobs, leadership, and service delivery. If we align advanced practice levels of education to optimize roles within our health and academic systems to meet the quality standards, align with population health, and ensure that our faculty are trained with the clinical expertise that's highly relevant, we can really leverage advanced practice nurses, as well as drive investments for leadership, for both clinical and non-clinical dimensions of practice. How we attract, recruit, and retain advanced practice nurses are where they're most needed in low, middle, and high-income countries is crucial, especially during the long haul of responding to COVID, for recovery and beyond. Lastly, strengthening the capacity and workplaces for advanced practice nurses to contribute within interprofessional disciplinary teams are also essential. Next slide, please. Advanced practice nurses have been shown to provide a wide array of services. Next slide, please. Safely and effectively, such as generalists or family nurse practitioners, or specialists in anesthesia care. They could also be in child health, neonatal, or geriatric care as well. Next slide, please. The enhanced ability of advanced practice nurses that are poised as evidence-informed workforce solutions can answer health call systems through the national and global revitalization of our nursing profession and health systems across the world. Advanced practice nurses have an education, experience, and evidence to support, stabilize, and sustain our disrupted system. Evidence shows that advanced practice nurses improve population health outcomes and contribute to innovation and quality improvement to increase access to quality healthcare services, particularly in underserved and low-resource settings. There's a paucity of research that examine the value of advanced practice nurses and achieving consistency in our role, definitions, education, and regulation are required to really implement, integrate, and sustain the roles to inform government, organizations, and policymakers to drive your return on investment as well. Next slide, please. The International Council of Nurses has established a nurse practitioner advanced practice network almost 20 years ago with 3,000 members across the globe, over 103 countries, and are excellent international resources. They are active and engaged in terms of the clinical and non-clinical dimensions of advanced practice, including research, education, health policy, communication, and a lot of different activities that are influential and impactful. We encourage you to join as well. Next slide, please. I've shared the link to join the network. It is free of charge, and let's really amplify and connect in your communities of practice to support locally to globally as well. Next slide, please. This slide actually showcases our collaborative relationship with Springer, and we have a significant APN series that will help in terms of role transition and full impact of the role value of advanced practice. So please have a look at these, and I did include the link for you as well. They can be embedded in curriculum. They can help across an advanced practice nurse's career trajectory to ensure competence, confidence, and great impact and influence as well. Next slide, please. Lastly, we're excited to share with you our International Nursing Review Journal that is being organized and will be coming in later 2023 on advanced practice nurses. And the title is Towards Health and Well-Being, to showcase our regional and country examples, as well as innovations in practice, a lot of advanced practice-led services, and original research. And after Montreal, save the date, because we will be in Aberdeen, Scotland for our Advanced Practice Conference in 2024. Thank you so much. And I'd like to actually shift next to Dr. Gil Adinsky, our Nursing and Health Policy Analyst.
Hello, all. Next slide, please. My name is Dr. Gil Adinsky, and I serve as a Nursing and Health Policy Analyst here at the International Council of Nurses. I'm going to be talking to you on the ICN's work on gender equity today. Gender equity is a very important part of nursing work and the nursing workforce, as we are a profession made up of 90% females. Nursing has also been historically underpaid. And this aligns with the healthcare sector having a gender pay gap that is 28% higher than other economic sectors. Nursing as a profession is stigmatized and stereotyped in ways similar to women who also work. Nursing is a caring, nurturing, and feminine profession, and in that regards, it often goes underpaid and unpaid. Next slide, please. Women and nurses alike face many difficulties in work. Nurses and women hold lower status jobs, are marginalized in leadership, face obstacles to career progression, experience unacceptable rates of workplace violence and harassment. They go unpaid and underpaid for their work, and they face bias, discrimination, power imbalance, privilege, and stereotyping in the work environment. Next slide, please. The ICN is doing a lot of work right now to combat this discrimination against women in healthcare, as well as the nursing workforce. The ICN is currently advancing its agenda on gender equity for nursing and the health sector. Later this year, the ICN will be releasing a position statement on gender equity, which highlights a variety of different issues that women face in the nursing workforce. The ICN also engaged with the Pan American Health Organization to speak at the United Nations Regional Conference on Women in Latin America and the Caribbean, where it spoke on the importance of fairly paying nurses and women care workers across Latin America and the Caribbean. The ICN currently has a standing gender equity committee made up of nursing expert board members from all around the world who are seeking to address a variety of different gender equity issues within the nursing workforce. Next slide, please. A few issues that this committee is currently addressing is the advancement of nursing and women into leadership positions in the healthcare sector and beyond, the importance of intersectional feminism when it comes to advancing women in the workforce, and intersectional feminism is the overlapping experiences of concurrent forms of oppression in order to understand the depths of the inequalities and relationships among them in any given context. It's also addressing gender minority issues, such as LGBTQIA persons, as they face health disparities and issues advancing into leadership. It's also addressing violence and harassment of women and gender minorities in the workplace, and the unpaid and underpaid work of nurses and women in the workplace. Next slide, please. The ICN believes that nurses need to make sure they have fair pay, and fair pay is needed for the recruitment and retention of the nursing workforce that we heard about earlier in this talk. It's also needed to make sure you have good working. This is also needed to combat the difficult working conditions post the COVID-19 pandemic. Hospitals and healthcare systems need to evaluate their gendered pay care models towards the nursing profession so that nurses can have fair pay. Women and gender minorities need to be advanced into leadership and senior positions in the healthcare sector and beyond. Finally, we need safe working conditions for women and gender minorities and nurses so that they can be free of violence and harassment in the workplace. Next slide. To hear more about the ICN's work on gender equity, we invite all of you to join us next month at the Commission for the Status of Women, where we will be hosting an in-person parallel event with our partners JPIGO and Sigma Theta Tau International. This event is entitled Digital Transformation of the Nursing Workforce and can be found at the time and location on the slide above. I would like to next welcome to the stage Richard Elliott, our Director of Communication and Events, and he'll be talking to you about a few other initiatives the ICN has going on.
Thanks very much, Gil. Yeah, if we go to the next slide, please, Cyril. So I do want to tell you about two important pieces of work that we've been doing in the last year. One is our Nurses for Peace campaign, which was born out of the invasion of Ukraine, which, as I'm sure you're very aware, was almost a year ago to the day, 24th of February 2022. In the aftermath of that, we quickly connected with our Ukrainian Nurses Association and associations in the region. And we asked really what could we do to support them in these really terrible circumstances. So we were realistic about what influence that we could have. But one thing was very clear, was that nurses around the world really wanted to show their support for their colleagues who are suffering so much and doing such fantastic work in such terrible circumstances. So we created basically a social media campaign under the hashtag Nurses for Peace, which was partly about solidarity, but was also about collecting donations. And we were pleased that we were able to collect some substantial donations, which we've been able to feed through the Ukrainian Nurses Associations and the other associations in the region, so that we could make sure that some of these funds could be put into the hands of the nurses, whether that be through clothes or food or supplies or any way that we could help to basically support them. If we go to the next slide, please, Cyril. In terms of the campaign impact, it was substantial, as you can see from the figures there on the screen. We started with a fairly small petition for peace, which you can see represented 450,000 nurses around the world, which we know is a fraction of the nurses around the world, but it was still significant because it showed the solidarity. We reached more than 100 million people through the campaign in the initial weeks, and there were 680,000 plus interactions, so likes and shares and so on, through the different social media platforms. And also more than 13,000, that number's gone up substantially since then, where people have changed their Facebook frame to use the Nurses for Peace logo, the branding. So I think it shows really how proud nurses were to stand and to do what they could around the world for their colleagues. And if we go to the next slide, please. So Nurses for Peace is not a standalone campaign for ICN. It's part of our humanitarian work. And it's not just about getting aid at the moment. It's also about a longer term plan to help countries and nurses in countries where they're struggling, because of whether it doesn't necessarily have to be because of an invasion. It can be something like we've seen in the last few days in Turkey and Syria with the earthquakes and so on, natural disasters. So our humanitarian work really is about solidarity, but it's also about us helping our network of NNAs, which, as you know, is 135 plus strong around the world, representing the nurses of the world, more than 28 million. We're also supporting at the moment nurses in Afghanistan and Myanmar. And as I say, this has now become an important part of our strategy. And it's really been borne out or spurred on by what we've seen in the last year. And next slide, please, Cyril. Finally, I just wanted to mention another project that we've been doing in the last year, and which we continue to do with the BBC, which is our series, Caring with Courage. Now, these are video films that you can see by clicking on that link, and we'll put the actual link into the chat in a second. And these films, they're short films, 4 minutes long. They're from around the world. They are very high quality videos produced by the BBC with us as a partner, with ICN as a partner. And they show the impact of nurse leadership, and they make the case for investment for nurses around the world. And of course, they also go back to something which is essential in nursing, which is humanity and nurses caring for people in many different circumstances. But we also see the use of technology, the importance of getting access for primary care. So we see there's a really good story in South Africa about a train which has been used as a sort of as a way to take a surgery or nurses around the country to areas where they wouldn't have got to. There are some fantastic stories here, which I'm sure that you would really enjoy watching. And this is just the first batch, and at Congress, which we hope that you can come to or at least be part of in some way, we'll be launching or showcasing more of these films, and it's ongoing work. So with that, we will put that in the chat so you can have a look at those films. I will pass back to the President. Thank you, Pam.
Thank you, Richard, and thank you, Gil, Michelle, and Howard as well. I hope you've been thinking about your questions as you've heard just a brief summary of a snapshot of many of the activities that ICN is involved in. We do have one question in the chat that I think is an excellent segue to describing even a little bit more about how we are going to achieve the charter that we talked to you about, where really our goal is to get a sustainable future that we have seen become a cry and a call, if you will, for better working conditions so that we can support and, as you heard, sustain and retain and increase our nursing workforce to address the significant departures and overall shortage. So the first question is how can ICN force, let me just move my screen here. How can ICN force political leaders in countries to support nurses in their daily activities in life to overcome high inflation that is in fact leading them to leave and go other places? So I'm going to just start, and I think others will want to join in responding, but we are very much aware as we look closely at the root causes of nursing shortage. And in some of the countries where you saw Howard describing the out-migration, it is in fact because working conditions are not supporting individuals. Salaries have fallen very far behind, and in some cases, nurses are not being paid, but the conditions of work that subject them to violence and discrimination and harassment continue to drive individuals away from the workforce. The specific question, though, about leaving countries to go to places where individual nurses can earn more is a serious concern. And we know that in some countries, governments are not funding the number of nursing positions that they need in order to provide the level of workforce needed in order to provide good care and make sure that patients are not only getting good care, but are being kept safe and that we're improving outcomes. So this is a major part of our agenda this year and into the future that builds on previous work that we have had working with our members who are doing some phenomenal negotiation and lobbying with their governments. That's really the primary place where we're seeing change be made. We have a number of our national nursing associations that have been successfully able to increase the number of nurses to be prepared in their countries. We've seen success in raising the wages. We've seen, particularly, and Howard, I know you're very able to cite some of these, so I'm going to come to you in a minute. But places like Switzerland, where they have had tremendous success with a referendum on the part of the public. We have, again, a number of other countries where we've seen an uptick in strike action, and that nurses are willing to put their livelihood on the lines to be able to increase their pay and other conditions in work. And we support their right to do that and want to be able to recognize that discussion, negotiation, really bringing data and evidence to the conversations that need to occur to influence governments is a key strategy. But part of our desire with the charter that we are formulating that will come forward about our nurses, our future, is in fact to create that conversation with our governments and as well as private employers to recognize that we don't have a moment to lose in terms of stabilizing the nursing workforce and addressing the areas that you've heard us talk about in terms of jobs, leadership, education, and service delivery, i.e. protection of the workforce. Because we fear that if we don't shore up the workforce now and we don't correct some of these conditions that are causing nurses to leave or feel unsafe or not be able to provide the best care, not be able to address their mental health needs, that we will continue to see a reduction in the health, not only of the workforce, but of the people that we really care about. So Howard, maybe you can address some of these other success stories that, again, this is not easy work to influence governments to want to realign their resources, but that's what we're talking about now. We must see some new and realigned investment.
Thanks very much, Madam President. As you've heard, our associations are our members, and they are absolutely critical to driving the advocacy and the policy work and the policy dialogue at a country level. But we work very closely with them, and we bring forward evidence that they can use to make the case in their countries. You've heard a lot about the nursing evidence that we can bring forward, but there's other evidence. We can bring forward the health improvement evidence to investing in nurses, people staying well longer, being more independent. And as a result of all of that, of course, that means that there's less of a demand on health systems, but, and something we don't talk enough about, is the flip side, is that puts productive, healthy people into economies. And there are there's very, very clear evidence for health investment being an economic driver. There are big safety issues as well. What's the role of our politicians to keep us, ultimately to keep us safe and secure? But if we don't invest in health, and if we don't have the right number of nurses with appropriate skills, we know that risks of ill health, if you're in hospital, medication errors, trips and falls, pressure ulcers, ultimately mortality, all rise if there are insufficient number of nurses. So that evidence that we bring forward is broad and it's wide to make the case. But we then can add to that learning of good practice and examples from around the world. We regularly meet with our associations on webinars and hear about what they're doing. In the last few weeks, we've heard fantastic examples from Japan about improvements to pay and conditions. In Ireland, looking at how they increase the supply of their nursing workforce. Madam President mentioned the Swiss example to get the public on side. Fantastic work in Australia on safe staffing levels and on the aged care sector. Look at the videos that Richard mentioned about the caring and courage. Again, examples of innovation in practice. So it's not something that you have to dream is possible in the future. We can bring the evidence of how it's actually happening now. And then also an important role for us. We're an international organization. There are very clear international charters, treaties and conventions that are relevant to nursing. The ILO have a nursing personnel convention. There's a health and worker safety charter from WHO. You've heard about the strategic directions for nursing and midwifery. There are the Geneva Convention in relation to war and conflict zones. We can make sure that countries and our associations are aware of what those standards are, but also when we hear countries coming to the UN, coming to WHO, making clear commitments about what they will do for their workforce, for their nurses, for their people, make sure we communicate that back to our association so they can, in country, say, look, it was great, Madam Minister, Prime Minister or President, to hear our country commit to do X, Y, and Z, and we'd like to work with you locally on making that happening. So it's a dynamic process, but it's a relationship that critically is through our national nursing associations. Often, I believe, one of the most under-recognized and under-acknowledged forms of nursing organization in countries. They do so much to support and to advocate for nurses, but also to bring forward solutions. And if you really want to know what's happening with your nursing workforce in your country, go and talk to the elected leaders in that country, the association, the tens and hundreds of thousands of nurses who will be signed up to be members of those associations as well. Back to you, Madam President.
Thank you, Howard. Following on a similar line of question in terms of what are these international accepted guidelines? One of the questions is looking at the code of practice. How is it being used? And how do you get on the list, if you will, if you think your country needs to be safeguarded? We do understand that the list of what are called red countries, and there's actually red and amber, which would suggest those are countries that should not have international recruitment because they really need to retain the nurses within those countries. Even as you've heard, there are sometimes bilateral agreements that allow for, I'll use the word legal in quotes, recruitment and transfer of nurses. And there's usually a fee that goes along with those agreements. So a wealthy country says, we will pay you X number of dollars for the recruitment of a certain number of nurses. Often those dollars are woefully inadequate to really cover not only the cost involved for those individuals, but it does not recognize the departure of the most experienced nurses from that country and the huge costs to educate them and replace them. But the Code of International Recruitment has not had the teeth that we would like to see happen. And I believe, and again, Howard, I'd ask you to question because I think you've had some recent conversations. This is really where the enforcement and being able to have some consequences is really important. And ICN has spoken out about this. There's been, you may notice there's been a fair amount of press coverage internationally about some of the countries that are in fact recruiting from the poorer nations that are again an issue. I would point out though that one of the other aspects of this issue that we are trying to address is again that there are nurses who are unemployed in their home countries because of the lack of investment. And so they are in a difficult situation of not wanting to leave their home country, but needing to find gainful employment. So we are juggling both of these issues as we think about the best ways to influence governments, but at the same time, know that the WHO International Code of Recruitment could be a key tool. Howard?
Specifically in relation to the question about how you get onto the red list, WHO use an indicator of universal health coverage to assess access to healthcare within a country, and that indicator is then key to determine how vulnerable a country is or not, and determines whether it goes onto the red list. So some of that is quite technical, but as I said, there's a model, there's a formula, and that's something which countries can ask to be looked at, or WHO will look at that as well. Nobody stands in the way of the right of individuals to move around the world, and we know that migration has brought opportunities for sharing and learning, which is positive, but the scale and the patterns of we've seen recently have resulted in some of the adverse consequences that you've heard us talk about. What the Director General said in his speech to the Executive Board last week, and firstly, I think important for us to note, he mentioned it in his opening speech, and one of the reasons he will have done that is because people will have been talking to him about their concerns. So just the importance of raising a concern. If you see the impact, if you think it's not working, if it's causing an adverse effect, whether it's through your National Nursing Association, whether it's through lobbying and advocacy work you might do, raise it. We often assume that people in power know what's happening on the ground, and they don't. And we and our associations have an important role, just making sure that those who make decisions know what the true facts are. So it's been raised with him, and what WHO have said that they will strengthen the global agreements to have extra protections for those most vulnerable countries. And the sorts of, we can point you to where you can see more details, but the sorts of things that they are saying, if there is going to be recruitment from a low-income country, then the country doing the recruiting needs to show how it might give back, how it might support to strengthen that health system. They need to have undertaken an assessment to make sure that if they are going to recruit, it's not going to mean that health services are no longer available for people in those countries. And there is an expectation that countries recruiting should be reporting to WHO as well. Often they don't, and that in itself can be a problem, that recruiters, if a government is leading a recruitment effort, normally they will talk to the other government, but we know there's a lot of private sector recruitment agencies who may operate without telling anybody. And we've heard the stories from nurses who've turned around and said, or nurse managers who've turned around and said, the first thing we knew that recruitment was going on was when we got the resignation letters of people who were going to leave. So that's a flavor of some of the strengthening, how people get on the lists, but again, some of the actions that can be taken to try and support and protect those countries.
Thanks, Howard. The next question relates to a concern that, again, I believe is shared in many, many countries, which is how can we ensure that educational requirements are maintained in the face of nursing shortages? We are very aware that in countries that have multiple routes to becoming a nurse, multiple levels of education, that there is in many cases a desire to say, how can we prepare someone faster and cheaper? And so this is an age-old challenge, but it really requires a constant effort to bring the evidence to bear to those who might be making decisions. And again, as was already mentioned, we know that not only the density and amount of nurses and other healthcare providers and healthcare in a community raises life expectancy, we also know that the education level of nurses makes a difference in outcomes. And we have 2 decades of research that reinforces this. Those studies have been done around the world, not only in high income countries. So we've seen that there is a great benefit of nurses with more education. So I think this is really a test for all of us to work with our national nursing associations to make sure that we are bringing the evidence, consistently resisting efforts to shorten those educational programs. Or, I mean, again, there's been a lot of criticism that that's a move backwards, because it has sometimes taken years for countries to be able to say, yes, we want university education as our baseline. That's part of the State of the World's Nursing Report and the strategic directions for nursing and midwifery, that we must standardize to the level of education and have standards that actually, again, provide education that is going to produce the best outcomes. So this becomes a campaign for all of us, and it is a big challenge, because we know that as shortages really compromise the amount of care that can be provided in some of our facilities, particularly our acute care facilities, that this is a very difficult issue for us to address, but we have to all kind of stand our ground on it. And again, we know that this is not an easy issue, because it's also meaning that healthcare facilities are not necessarily able to provide the care that's needed. But we go back to looking at, again, root causes of shortage. The root causes of the shortage are poor working conditions, inadequate pay, lack of safety and protection and investment. If we must simultaneously work on all of those to be able to retain the supply of nurses we have, educate and infuse more nurses into the workforce, make countries, help countries become sustainable in their own production. And then as we ease that shortage, we will no longer have that discussion about weakening the educational system. It's a multi-year process. All right, Michelle, I'm going to turn to you. We have a question that you'll see that with talking of advanced nursing practice, I never heard anything said on emergency nurses. And with ICN stand with Nurses for Peace, how do emergency nurses stand to help? Or are they on an as needed basis? So I think there's 2 questions there in terms of advanced practice nurses and maybe where are emergency nurses within that. But specifically, when we know we have countries that have conflict or situations like that, do we have, what can you share about the role of emergency nurses?
Thank you, President, and thank you, Ebenezer, for the great question. In terms of advanced practice nurses and specialties and sectors, I think we need to kind of break that down as well. So you could have your nurse practitioners, or you could have your clinical nurse specialists, but also emergency nurses could be certified in that sector specifically. We have seen the pivoting of not just emergency nurses, but critical care nurses or other nurses as well to help respond in humanitarian crisis. We do have disaster competencies that will help with competence and confidence in that area as well. We know that emergency nurses, for example, do not just conduct acute and episodic care. However, sometimes they're delivering care for health promotion and prevention, that those that do not have a primary care provider as well. So they are able to do that. Some of the issues that come out are in terms of regulation and scope of practice beyond the walls of hospitals as well. So they could actually be utilized in primary care settings or in disaster areas as well. I think the local global context are very different, but they do have generalist knowledge, skill, and judgment as nurses to be able to respond to population health. And then we could really amplify emergency room or other specialists in terms of if it's trauma, for example. We have some good examples as well of how we've utilized some of these humanitarian funds to actually train and educate for CPR response, for example, and first aid responses. We have stories of nurses, including emergency nurses, delivering care, not in the emergency room where it was unsafe and there was healthcare and conflict, but in the bowels of the hospitals, for example, as well, and trying to ensure ultimately the delivery of the best quality of care, and how they have truly mobilized to help support the population and remain the most trusted, courageous, compassionate care providers as well. Back to you, President.
Thanks, Michelle. Let's go to the next question on which brings us back to migration. And this is from Dominic, and he's talking about Ghana, where a lot of workers other than nurses were awarded additional pay, but nurses were left out. And the question is, why shouldn't we travel if we can make more money and seek better employment? And again, this is really a dilemma, but it underscores the fact that we know that in some countries, nurses are not appropriately being compensated. And the difference that you point out is really an important one, because obviously all of us on this call certainly believe that nurses are the backbone of the healthcare system, and that the system would be crippled if there were not nurses. Obviously, we know and appreciate the work that occurs in teams, but we cannot ignore or leave out nurses in terms of recognizing the consistent sacrifice and contribution that nurses make. So this is really a place for collective action. This is a time where you would want to have your National Nursing Association join forces with other associations in your country, with all interested nurses, to really go to your government leaders, to lobby them, to talk about how important it is to have the investments in the nursing workforce. On an individual basis, we know nurses will always migrate. That is a fact, and we see that as a constant, not just now but into the future. But we would hate to see countries continuously losing their really expert talent because the governments are not addressing the financial needs. So we know this is a difficult battle. I'll use that word carefully, but one that many countries are facing. So I hope that you'll be able to get collaboration and cooperation with others who would like to see that argument brought forward, so that we can help see additional investments occur in the nursing workforce. So the next question that is, I think, one on prioritization. It says there are committees of parliamentarians that that care about work on issues such as HIV or TB, but are there any such committees or caucuses that focus on nurses or their nursing? And this again is probably directly related to the ministers of health. And David is writing in this question, we absolutely agree. We want our ministers of health to be able to do more. We also know that the ministers of finance and the prime ministers and the vice prime ministers are absolutely important. And whenever we have the opportunity to be in a country where we are interacting with ministers of health or other high leaders, we talk about the relationship. And we want all of our leaders to be able to bring the message and evidence to, again, the ministers of finance that must collaborate with their ministers of health in order to be able to recognize that it may be a reallocation of money. There are now some joint meetings that are occurring that they were slowed during the pandemic, but ministers of health and finance are meeting together. And this is really a time, once again, to be able to forward interventions and be able to bring the case about what's happening in terms of retention of nurses. What are the key issues? Is it salary alone? Is it a combination with workforce? Bringing to bear the impact that nurses have on the overall health. I mean, you can be focused on HIV or TB or other non-communicable diseases, but without that nursing workforce, we know that the improvements aren't going to happen. So this is really, again, part of that more global agenda of talking to our government leaders, as well as other private employers, about supporting their nursing workforces in much different ways. Okay, I would like to turn to Gil, being the youngest person in our group of esteemed leaders, to answer this question, which is, should we be promoting nursing as a career much earlier? And I think many of us, this resonates with many of us, particularly with secondary school pupils, so that when there's earlier uptake and interest to be a nurse. So Gil, what's your take on that?
Thanks, Pam. Yes, I'm going to actually loop that in with Tom's question as well, who is asking about what we should be doing to fight for minority male nurses in the profession as well. I think what we need to be doing in secondary and primary schools is de-stereotyping nursing as a profession. We're a highly scientific profession. We are one of the only STEM professions to have majority women in it. And because of that, we don't always recruit as many males to the profession. So I think by advertising the profession differently, showing how scientific it is, we can bring more males into the profession as well, and recruit more people earlier in the career to highlight how important of a profession this is and how much impact the profession of nursing can have on policy and on the healthcare in general. With that being said, men do advance into leadership much faster in nursing. So we still need to do work to invest in young girls as well.
Thank you, Gil. So we do have a few more minutes. So if you do have additional questions, please put them in the chat. But I'm going to ask Howard to comment on one additional area. But it comes back to our overall issues of investment. And that is, as we think about the global strategic directions for nursing and midwifery, and we think about the relationships that ICN has with the World Health Organization and the International Labor Organization. And I'd like him to also share with you our work with the World Health Professions Alliance, because again, we know we are stronger together with our other partners. And this is a place where ICN is working together with our other colleagues to be able to strengthen the the overall healthcare workforce, because all of the things we've talked about, the different kinds of solidarity, the shoring up of education, the improvement of outcomes, meeting UHC and SDG goals, are really a multifaceted effort across professions. And so, Howard, would you just share some of that work, please?
Delighted to, and if I may just take license just to go, I just want to go back to add something, the question before Gil's response in terms of what we can be doing as a profession to support the advancement that we've talked about in many areas. I think that we need to look at our own leadership as well. There's a lot that we can do with the leadership in nursing to more powerfully advocate. If you don't have a chief nursing officer, advocate for one, but if we have a chief nursing officer, how does that person then connect with directors of nursing or other senior nurses in leadership positions within their health system? If you're in a hospital or a facility, who is the senior nurse, and how does that nurse, what governance systems are in place to allow those nurses to come together to talk to each other about what's happening with nursing care and healthcare delivery in their workplace? If you're part of an association, are you talking to the leaders in education, the leaders in regulation, as well as the chief nurses? So there's an awful lot that we advocate and want to see in terms of others supporting the advancement of nursing. But I think there is also a tough message for us of, are we doing enough ourselves as a profession to come together in some of the ways that I've described? The World Health Professional Alliance, WHPA, is the international alliance that brings together the International Council of Nurses, but the World Medical Association, our doctor colleagues, the International Federation for Pharmacy, the International Group for Dentistry, and the world's therapists as well. It's an alliance of representing more than 40 million, I think probably nearer to 45 million health professions around the world. And it's a really important set of relationships for us, because you've heard the president say, of course, we advocate strongly and determinedly for the nursing profession, but we recognize that we work in teams, we work in multi-professional teams, and many of these issues around education, regulation, recognition of our voice and leadership within health systems are based on the multi-professional teams that we work within. And we do some practical stuff. We have an initiative called Positive Practice Environments, where the global professions have come together to describe what the key factors are that need to be in place to support healthcare professionals in the workplace to have a positive practice environment, which we know translates into higher quality, safer care. Watch out for a new report, which is in the pipes and will emerge very soon from the World Health Professions Alliance, from all of the health professions, where we have brought together the evidence of the impact of the pandemic on the health professions, but also speaks to what needs to be done on a multi-professional basis as well. So we try very hard internationally to walk the talk in terms of multi-professional, multidisciplinary team working, as well as encouraging and supporting that at a local and a regional level as well.
Thank you, Howard. One last question, and that is, can we comment on the need for governments to employ and retain nurses, especially in poor indicator environments? And clearly, building on what Howard shared with you, one of the things that we have been consistently advocating for many years is for countries to have a chief nursing officer, and one that has power and has a budget and is listened to in the government, so that they can advocate and that they can be part of the decision-making policy group within a country. We have seen that number increase. We do survey countries about every 2 years. Again, not everyone who has a chief nurse has them empowered, but we continue to support our national nursing associations in their call for chief nurses, and again, align work with them so that we know that we can help strengthen that work. That being said, we also certainly support advocating for nurses being employed throughout the government in different roles, because we do see that it makes a difference. That nurse on the ground within government agencies and within government programs can really bring the most current information to bear. As you heard Richard mention, the BBC StoryWorks examples, you will see in their examples where the nurses are making a difference. They're working with their governments. They're using big data platforms to track non-communicable diseases and see improvements in the health of their countries. They're working with public health agencies to make sure that their individuals in their communities can overcome fears of seeking diagnosis and healthcare. So there are many things that we know can be accomplished with those relationships. So we appreciate all of your questions today. I know a few more have just come in that we will not be able to answer, and maybe I don't know whether we had a question about, can the slides be shared after the webinar? Is it possible that there will be a send out? I'm looking to our staff to help in this, and we could also maybe answer one or two of these questions that we didn't get a response to. Maybe Richard, do you have the answer to that?
Yeah, we can certainly answer the questions, and we might be able to share some of the slides.
Okay. Well, I want to thank all of our presenters as well as all of our participants for being with us today. We appreciate your support of ICN and all that you do in your roles, whether you're a nurse or someone who supports nursing and healthcare. We know how critical it is. These are very challenging times, but we also know that nurses are the answer to many of the most pressing challenges in healthcare. So thank you for joining us today, and we look forward to all of the successes that we will achieve together to strengthen nursing and global healthcare. Thanks a lot. Bye, everybody.